Many South Africans over the age of 18 have expressed excitement to finally have the opportunity to get the Covid-19 vaccination. This after government announced that those aged between 18 and 34 will be allowed to get vaccinated from today. Earlier this week, the Human Sciences Research Council, together with the Centre for Social Change at the University of Johannesburg, found that younger people may be less likely to accept the vaccine than older people. Now, to discuss this and vaccine hesitancy, we are joined via Zoom by Professor Carin Runciman, and she's the Director for Centre Social Change at the University of Johannesburg. I beg your pardon. We're also joined by Dr. Sheri Fanaroff from the Gauteng General Practitioners Collaboration. Thank you for your time this afternoon.
Thanks.
Dr. Fanaroff, perhaps let me start with you. Now that all adults essentially in South Africa can get vaccinated, how hopeful are you that we will reach herd immunity before the fourth wave hits the country or before February 2022 as projections go?
Herd immunity is a difficult concept to get on top of because it's actually unlikely that we're going to get to the point where the virus is not spreading at all in the community. And that's essentially what herd immunity is. So what we're really aiming for is to have the most people vaccinated so that we are preventing severe illness, hospitalizations, and death. And that applies to both younger and older people. The more people that are vaccinated, the less chance the virus can spread in the community, and the less people who get severely ill from the virus.
So you must be very excited now that 18s to 34-year-olds can vaccinate, because, as you say, that would at least, give us chance as South Africans to have more people vaccinated. But there is that question of hesitancy, isn't there?
Absolutely. So, people are very much influenced by what they read in their papers, what they read on their social media news feeds, what they hear on the news. And unfortunately, there's a massive amount of misconception out there. And besides fighting the virus pandemic, doctors are fighting this massive misinformation pandemic. And so as a collaboration, Gauteng GPs are really trying our best to put out good information to address vaccine hesitancy and to counteract a lot of the myths and the misconceptions that are put out there on social media. And we're really trying to get the message out that the vaccine is safe and that the vaccine is very effective.
Professor Runciman, let me bring you in. Talk to us about the recent survey you conducted around vaccinations, particularly hesitancy. What are the reasons that were provided by those in support of vaccinations against those who are more hesitant?
So the really encouraging news from our survey results is that 72% of adults say that they are willing to vaccinate. And among those who are willing to vaccinate, their primary reasons are to protect themselves, but also to protect society. So while that 72% figure is really encouraging, it still does mean that we've got 28% of people that are currently hesitant about taking a vaccine. And for those people, the primary concerns that they have are about side effects and the effectiveness of the vaccine. Any explanations related to conspiracy theories or religious reasons are present in our data, but are very much the minority of explanations. So while there is a concern that people are hesitant, the fact that their concerns are about side effects, about the effectiveness of the vaccine, which are things that hopefully we can address through good public health messaging. And again, what our data shows is, although countering misinformation and social media is really important, that television and radio are actually very critical sources of information for people. I think this goes to issues of trust. People don't necessarily trust what they see on social media and are much more likely to trust the information they get from television and radio. So it really makes platforms like this really, really important for addressing hesitancy.
Prof, your sound is a bit unstable, so let me pose this next question to you as well. Now, we are hearing that those under 35 years of age are more hesitant. Is this information based on your recent survey specifically? If so, how likely is it that the results could have been skewed in terms of who has access to smartphones, particularly between older versus younger and urban versus rural residents? Because I know that your survey particularly used a method that focused on smartphones.
Yeah, so the survey was primarily conducted using a data-free platform and Moya Messenger app, which has very widespread coverage through the country. About 18% of our participants actually lived in rural areas, 42% in townships, 12% in informal settlements. So it does have quite a wide reach. Where we did have a coverage gap was with older people, and this time we had a telephone survey in order to also engage those older people. So we do think that our survey is broadly representative of the population, and that's also because we have weighted our data. What it does show is, as I've said, is that lots of people, and regardless of age, television and radio are the two main sources of information about COVID-19 vaccines. Social media is obviously more used by younger people than older people, so it is really important to counter misinformation on social media. But I think what this also underscores is the importance of other forms of information too. It's not just about what's on social media, it's about making sure that we have good campaigning on television and radio, but also that we have feet on the ground, door-to-door campaigns. And we also revisit things that have been done, for instance, around HIV/AIDS, so community interventions, the involvement of civil society. We're going to do all of these things in order to combat vaccine hesitancy.
Dr. Fanaroff, taking into consideration what the professor has just said, what do you think is needed in terms of just a voice where, to prevent such hesitancy, especially where it applies to people who are misinformed about vaccinations? I mean, we've heard that, reliable sources even, professionals coming out to say, well, there's not enough information around vaccinations and, they could lead to death, etc. What voice is needed? Especially if government is saying it is doing enough, to go out there and campaign and inform the general public.
I think that all doctors on the ground need to address their own communities, their practice populations. I think that leaders across the board, leaders that aren't doctors, church leaders, religious leaders, corporates, really need to look at how they can encourage their populations in the, people that are immediately touched by them. A lot of corporates are looking at why their employees are vaccine hesitant. They're getting people to address them, to discuss what their issues are, to try and answer their questions. Because as Prof said, a lot of it is to do with not having the knowledge or having the incorrect knowledge. And I think that there's a lot that corporates can do. If you look at other countries in the US, they're offering $100 a vaccine at the moment, just as an incentive. They're kind of trying to put a carrot out there. We haven't really taken that up much in South Africa. I know Wimpy have a free coffees for vax campaign. I know that Game are giving discounts. But in some countries, you can get a free pizza, you can get a tot of alcohol, for example. And I think that kind of creative thinking might get young people, especially a bit more excited about a vaccine. It's not necessarily addressing the message of vaccines are safe, but it's just creating that little bit of an incentive for them to go out and get there. And I think that a lot of corporates could come on board with that kind of thinking.
Professor, I also want to get your thoughts around the hesitancy, but perhaps let me continue asking Dr. Fanaroff just on something that you've just touched on. In terms of, some of those hesitancy and the misinformation that people are hearing. One of the biggest, especially when you hear, that a young person has passed away from COVID-19, one of the first questions people ask, were they vaccinated? Because there is this misconception out there that once you've been vaccinated and you contract COVID-19 and you die, it is because you got vaccinated as opposed to you having had a secondary infection. Please, can you just dispel some of those misinformation?
Well, SAPRA actually published their statement in the last 48 hours where they investigated 56 deaths that were potentially linked to the vaccines. And in fact, they found that they could not attribute one of those deaths to the vaccine. So in fact, to date in South Africa, there's actually not one death linked with the vaccine. And there are tens of thousands of deaths linked with COVID itself. So, the data is indisputable. COVID infection causes deaths and it causes severe mortality. Even in those people who don't end up in hospital, we're dealing with a pandemic of long COVID and people who have symptoms that last for weeks and for months and debilitating symptoms. Young patients in their 40s and 50s that are left on oxygen, that are left short of breath. And the vaccine is not doing it. The chances of getting a side effect to the vaccine are minuscule compared with the side effects and the long-term effects that COVID itself has.
Professor Runciman, I've found that those that have not vaccinated yet and they belong in the older group, it's not necessarily because of hesitancy towards the vaccine. There's just this lackluster kind of approach to getting vaccinated. And these are people that are supposedly well-learned and they understand the benefits of getting a vaccination. What do you think of incentives, as we've heard from Dr. Fanaroff?
I mean, I think incentives, they have been used in other parts of the world, and I think, we can certainly try them for the South African context. I mean, they certainly cannot do any harm; they can only do, hopefully, some good. But I think, some of the crucial stuff is around addressing the misinformation. One of the critical concerns at the moment of many people, and I think particularly young people, is understanding how breakthrough infections are still possible after vaccination, and why that is, in a sense, it's a possibility, but why still being vaccinated is going to give you a much, much better chance if you are infected than if you were unvaccinated. So, so I think incentives are definitely something we can be doing. But I think as the doctor indicated, there's an awful lot that other people can be doing as well. Corporates, she was giving the example of engaging their employees around vaccine hesitancy, having people come in and talk to them. And I think this is where, again, institutions of higher education have a very critical role to play, given that it does appear that students are slightly more vaccine hesitant than other people in the population. So there's real work to be doing in all kinds of organisations to educate, and I think in a very positive way. I think what's very important is that people are engaged positively about their concerns, speaking to them in a way that is kind of top down or making them feel as if they are somehow wrong to have a concern might drive people further into their hesitancy. So I think it's really important that we have dialogue that can hopefully change people's minds through good engagement and good education.
Dr. Fanaroff, I'd like to touch on something else now. Earlier, government was obviously criticised just about the rollout, the slow rollout of the vaccine. Also, just criticism around its coordination. Now that we seem to be starting to pick up, I mean, we're sitting at more than 10 million South Africans that are vaccinated, at least some of them having that one-shot vaccination. But there's also this talk of other variants, creeping up. Talk to us about what the latest information is now in terms of what variants are we battling at the moment? Which variants are those that are of interest that you know of?
At the moment, Delta is the main variant worldwide, and certainly in South Africa, it's accounting for more than 95% of illness, possibly even more than that. The Delta variant is highly, highly contagious and highly transmissible. So for every person who gets infected with Delta, they are likely to infect between 5 and 9 other people. The variant that originated in South Africa, which we had before that, the Beta variant, had its own problems and, in fact, unfortunately put South Africa into red country status across the world. And, in fact, we have almost no Beta variant left in South Africa at the moment at all. Delta variant is a little bit more susceptible to vaccines than the Beta variant was, which is good news. But the fact that it's more transmissible has also meant that we've seen more younger people being infected. And because of the fact that there are more people infected, there are also more young people with severe illness.
Professor Runciman,
just to touch on newer variants that are coming up, the one of most concern at the moment is probably the Lambda variant, but at the moment we're actually not seeing that in South Africa. But we know that viruses mutate, so we do expect more variants. The more people who are vaccinated, the less chance the virus has to spread and to mutate. And that's why it's so important to get the vaccination campaign out and rolling as soon as possible.
Dr. Fanaroff, just on that last point about the mutation. So what you're saying is we definitely then need to start gearing, especially this younger age group that has now started vaccinating, to do so, but also do it fairly quickly before we see another kind of mutation happening in South Africa, particularly if there is this fourth wave we're being told about that will come in the country by December.
Exactly. The more the virus is allowed to spread within the general population, the more chance it has of changing and new variants emerging. And what worries us about new variants is that they may be more transmissible, and they may also be able to escape vaccines or evade vaccines. So the sooner, and that's why it's important not to wait. You know, some people have said they want to wait to see what the response is before they get vaccinated. We actually don't have the luxury of time. We need as many people as possible to get vaccinated as soon as possible.
And that is quite scary. Prof, perhaps let me end off this interview with you. You've heard what Dr. Fanaroff has had to say. We are very excited in the country, obviously. I mean, any good news is great news for us. Now that the 18 to 34-year-olds can vaccinate. Having done the survey, probably will do another one in a couple of months' time. How confident are you that we would have seen a change of mindset, just a turning point in the country now that essentially all adults can vaccinate?
Yeah, I mean, I think looking at international experience, what has happened in most other countries in the world is as vaccine rollouts have gone through different countries, vaccine acceptance in those countries has also risen. And really that's what our survey shows, that we've got a 5% increase from the beginning of year up until about the middle of the year. And we would expect the rate of acceptance to increase. However, obviously what is critical is converting that acceptance into actual vaccination. And that's in a sense where some of the challenge, I think, is currently at. That probably what we'll see the initial excitement of the first few weeks of the opening up of the rollout to the younger age cohort, and then we'll probably see the plateau effect like we did with the 36 to 49-year-olds. So I think this is where it's going to be really important to have mobile vaccination sites, pop-up sites that are really going to get vaccines to the people rather than expecting people to come to the vaccines. That obviously the inequalities of our society mean that getting transport money for many people is actually a very, very difficult thing. So it's not necessarily that they don't want a vaccine, they're struggling to access the vaccine because of economic challenges. I think, this is where Limpopo has obviously been doing excellent work in this regard. And I think other provinces are beginning to look to Limpopo and copying similar initiatives. And hopefully this will really make sure that acceptance does convert into actual vaccination.
That's all we can hope for. Thank you so much to you both for your time this afternoon and for your analysis. We really do appreciate it. Professor Runciman and Dr. Fanaroff, thank you very much. All right, on to this now.